I'm Dr. Clare. I'm a GP and a medical herbalist. My background is that I trained in medical school in Dublin, in Ireland, and then went to enjoy lots of opportunities while working in the UK, eventually becoming a GP in North London. While I was a GP, I had the opportunity of studying for a degree in clinical herbal medicine at the Middlesex University in North London. People often ask me, why did I change from being a GP to a medical herbalist? And my first answer is that I never did, that I value equally my medical training and the wonders of pharmaceutical medicine, as well as having the opportunity to study the clinical use of medicinal herbs. And for that reason I describe what I do as integrated medicine. Much of my interest in using plants as medicines came from being an enthusiastic as opposed to a very successful gardener. And I think gardening was my outlet for creative endeavour and just generally relaxing after a busy life in general practice and raising a family. So the herbs to me were very soothing and healing before I ever learned about their properties. When I was given the opportunity of studying the herbs, I would say that really they were kicking at an open door, but also with a very sceptical, I was very, very sceptical. The herbs were claiming to be useful for all kinds of things, and I had a fairly jaundiced eye, I'm afraid. The training was very thorough. I was well impressed, and gradually the use of herbs began to fit in with the logic of physiology and the function, the structural functions through our physiological integrity. Physiology is how all of our cells work at a cell level, combined as organs, combined as systems which leave us as we are, and of course combined with the mental and spiritual aspects of who we are. So the herbs, to me, answered a lot of the questions that my patients were asking for help for, without some of the side effects which made me wary of using some of the herbs, using some drugs for conditions that they didn't seem suited for. In other words, they were very powerful drugs and had very powerful effects. But what I wanted was kind of a mild effect and a gentle effect. For conditions like hay fever and irritable bowel and migraine, these were conditions, premenstrual syndrome, early arthritis. These were the conditions that I was treating with medications that I thought, gosh, that's a big, big pharmacological sledgehammer. So using very powerful drugs like the pill for symptoms like premenstrual stress, where I wondered, could there possibly be something which addressed more the physiological imbalance, because it's not really a disease, but it's more an imbalance of our internal environment. So while I was looking for something that would do that, I didn't quite believe that I would find it. But happily, over 2 years of serious training using herbal medicine, apprenticed to some of the top herbalists in the UK, because I had a very wonderful opportunity of doing that. I gradually realised that herbs were actually as powerful as their history told, and used with a reasonable amount of managed expectation. It often takes a little bit more time and an investment in diet and exercise and overall good living, by which I include a glass of wine and some dark chocolate and lots of dancing and fun. But along with all of these things, that's one of the things I liked about herbal medicine, is that herbalists generally like to have fun. So they were the reasons why I enmeshed my career from then on in herbal medicine, because I felt it had so much to offer my patients. And each patient to me is more like being Miss Marple, you know, where every individual system isn't functioning for different reasons. So trying to choose herbs that will suit that individual patient at the right pace. There's more of an art and judgment for each patient, and the communication is very important as well. I developed the blends of herbs because not everybody has the luxury of seeing a medical herbalist, and the herbal blends are in the tradition of doses which are effective, but traditional doses, and which are very low, but blended together with other herbs, they have an accumulated action which very gently but very firmly addresses some of our imbalances, so that hopefully you can enjoy a choice in having a natural medicine to deal with some of your health problems, as well as what's offered through pharmaceutical medicine.